Hi, good afternoon, everyone. Welcome back to another issue of Healthier You here at Oswego Health with our Facebook Live event. We missed you in July, but we're happy to be back with you here in August. And the middle of August means one thing in my house anyway, it is getting ready to go back to school. So summertime, winding down, getting all those school things. So this month we wanted to talk with you about getting your kids ready to go back to school. I'm so glad you joined us. I'm Katie Peglaroli, the Corporate Director for Integrated Healthcare here at Oswego Health, and I'm joined today by Dr. Christina Liepke. She is Oswego County Medical Director, as well as a primary care physician here in Oswego, as well as Jessica Digby and Bobbie Vangorder, also physician assistants at Oswego Family Physicians. Thank you all so much for joining me this afternoon. I think we have a great topic to talk about, something that a lot of us are interested in as we're getting those kids ready to go back. Dr. Liepke, I'm going to start out with you. As a physician and a parent, how are you planning on keeping your kids safe, and what do you recommend for keeping kids safe as we get ready to go back to school?
Well, first I wanted to say thank you for having me. It's always a pleasure talking to you guys. I love you, Katie. You've been a fabulous partner throughout this pandemic. My kids are older. We just sent my youngest to college for the first time. And, I think being a parent in this day and age has been a little scary, a lot of changes. And this school year is no different. This school year will be different for all of us, no matter if you were virtual last year or in person last year. This promises to be a different year. So I think it's really important for all of us to, as parents, check in with our kids in terms of their emotional well-being. Allow them to voice any concerns or anxieties about what this new school year will be like, and acknowledge those anxieties even if they seem silly. I've seen a lot of patients where kids are very scared about going to school because they haven't been to school in a year and a half for those kids who've been virtual. And I've seen other kids who are super excited about going back and seeing friends, and maybe they have this false impression that everything's back to normal, and or maybe they're a little bit nervous about who will I sit with at lunch, or what will lunch look like, and things are so different. So make sure you let your kids kind of say what they're nervous about, acknowledge that concern. Some did thrive virtually and may need help thinking about who they want to sit with or what it'll look like with masks on. Some struggled with virtual and need a reminder that this year will be different. It might be better. And I think it's important, whatever our own views are, whether we're pro-mask, anti-mask, pro-vaccine, anti-vaccine, we should be mindful of the anxiety our children face when they perceive conflict, when we're talking around the dinner table and listening to the news and sharing our views. So what can we do for our kids to help them stay safe as we go back to school? Well, if you're comfortable, of course, and your student is 12 years old or older, you can get them vaccinated. You can go to the Oswego County Health Department Wednesdays 1 to 5:30, or see our website for other alternative locations to get them vaccinated. Or Walgreens in Fulton has been offering Pfizer, or you can call Connects Care. Even if you're not a patient there, they've been having clinics. The other thing is get your child ready to wear a mask. Find one that's the most comfortable. Even though my kids aren't in high school, they're going to college, they have to wear a mask all the time. And I've noticed that athletes sometimes prefer those disposable 3-ply instead of a cloth mask that you can get at Dollar General or Amazon. Others seem to prefer those cloth masks that have the seam down the middle that are kind of a little bit farther away from their face. So there's a lot of different kinds of masks out there. So help your kid find the one that's the most comfortable for them, that still fits, snugly over here and down here, but it doesn't have to be smushing their little noses and stuff. And it's important to remember that that mask is to protect others kind of more than it is to protect your kid. There's some funny little memes about that, but it is important to remember that the mask is not just about protecting yourself, but protecting others. It's also important to remember that masks are safe for students. They are safe for children. There's a really good study in JAMA, March 1st, 2021, where they studied children who were masked during play, and their oxygen stayed normal and their end-tidal CO2 stayed normal. There was also an interesting study, I found this really fascinating. So before the pandemic, it was, I believe, in China, they were looking at the effect of smog and pollution on kids and how to mitigate that, because that can be very dangerous for our lungs in terms of cancer risk, et cetera. So they took kids 7 to 14 and literally fit tested them for the N95s that are so hard to come by now. And I did not mute my phone. I am so sorry. That's my son. Hopefully he doesn't need a mask. I don't know. So they fit tested 7 to 14-year-olds with N95s during exercise, put them on a treadmill literally, and their oxygen remained normal, their pulse remained normal, and their end-tidal CO2 remained normal. So I know that there's been some concern out in the community about a different study that was in JAMA published relatively recently about CO2 levels in the masks. Please be aware that that was retracted because of concerns about the device used to measure CO2. And in that study, they did not check those kids' oxygenation. So again, wear a mask, get your kid vaccinated if you're comfortable with it, and talk to them about how they're feeling, you know.
That's so important to remember, and great advice as we're getting our kids ready. I think back to school is always a little jittery anyway. For me, I remember those days, and adding in some different things like masking and what will school look like. That's really great advice to be aware of. Let's let them talk about it. And we talk about it too, right? When we're expressing how we feel about it. So thank you so much for that. Jessica, I'm going to move to you here. Why is it important for your child to get regular child well visits, to get their annual physical? Talk to us about how that helps us.
So we like to see our annual well visits with our kids here. Obviously checking growth and development, making sure they're growing and developing appropriately. We talk about things like Dr. Liepke mentioned, especially with this back to school surge that we usually see with these well child visits now. Everybody needs to get their visit in right away. They've got, fall sports and things like that. So also clearing them for sports and making sure that they are safe to participate in sports, making sure they're up to date with their vaccines, because there's specific vaccines other than, to go into kindergarten that you'll get a note home from the school nurse that will say, oh, your child can no longer attend school until they have their tetanus shot or they have their meningococcal vaccine. So making sure that you're getting those annual visits so that the conversation can happen and it's not a rush. Also screening for issues like anxiety and depression, and especially in this past year, discussing with kids, what has school looked like? How have you handled it? What are you anticipating for the fall? And we do a lot of that again with this rush that we see right now. We like to make sure that kids are up to date with those things, and that parents have questions answered. We talk about healthy lifestyle, and we try to catch things before they become a problem. So those annual visits, I know sometimes the schools will offer just a quick sports visit, and so parents will kind of see that as, oh, my child has had their physical, and I can't speak to what is done in those visits, but I do know children will come back and they're out of date with their immunizations, or we haven't done their appropriate screening. So we really like to see them in an office where we know their medical history, where we can continue to follow anything that may have been abnormal or a concern in the past, and just make sure we're up to date, similar to adult well visits, just to make sure we're on top of things. So we like to see them once a year.
Great. Thank you, Jessica. It helps too when there's subsequent sick visits, right? You already know how they are when they're well. Those are great points,
Yeah.
and I appreciate that. All right, Bobbie Ray, we're swinging over to you here. So during summertime, at least in my household, probably others of you are like this out there, but the routine becomes a little different, right? Bedtime might get moved, wake up time might get moved. We kind of get out of that routine that we may be in when we're in school with our kids. So talk to us about that. What's appropriate once we get back to school? Do our kids need sleep? How do we encourage them to do that? What do you recommend?
Well, they definitely need sleep, that's for sure, especially for their mental health as well as physical health. But different age groups require different amounts. The younger they are, the more they need to sleep. But, you know, starting with kindergarten up through grade school, about 9 to 12 hours a night. And middle school through high school, about 8 to 10 hours a night. But I do think as school starts back up again, or even like a few weeks before that happens, it's good to restart a routine. You know, whether they take a bath every night, do a book, you know, parents read, kids read, whatever, to relax them, set up something that they expect that after this is done, I need to relax and this is my time. Older kids, it's good to kind of restrict electronics use before bed and things like that, which gets difficult with homework and that. But, you know, leading up to school, you can certainly reinforce, you know, a relaxing, quiet environment before bed and letting them have that time to reflect, talk, read, whatever they want to do before they do lay down to go to sleep at night.
Great. Thank you so much. I know that's one that we talk about in our house, putting electronics away. And it's a discussion, right? This is why, and we want you to get a good night's sleep. So that's great. Now we're also taking questions from the community. Let's see if we have any outstanding questions out there. I do know that there was a question about whether or not what the rules are for kids who are sick, especially in this pandemic age. If anyone wants to tackle that, if kids are sick, they should stay home. They need to contact their provider, correct? And that's really any illness that they have. The list of symptoms is so long, really nothing's changed over last year for sick kids. Anyone want to have any input into that?
I think what you said was appropriate. I mean, it seems like if anyone had children in school last year and they got that list home, or they got a phone call from the nurse and it was just like, but they have allergies or they have a headache, and those frustrations will likely continue this year. So if your child does have a new symptom, whether it be as mild as a stuffy nose or a slight little cough or a bellyache, we're just asking people to keep them home and contact their medical provider. Otherwise, the nurse will probably call you and send them home.
That's right. And that's one way that we all play our part, right, to keep our community healthy. And we thank you for that in advance. We know we get a lot of questions about that. So, all right. Well, I want to thank you all for joining me today. This was great information as we get our kids ready to go back to school, something that we're anticipating, looking forward to. I appreciate your input and your expertise, and so does our Facebook family. As a reminder, we'll be back with you next month we have another topic about keeping our community healthier. And thank you so much for joining us as you get healthcare here right at home.
Thank you.